let's concentrate on two. One, there is an excitator, the commonest excitatory that excites the brain cells is called glutamate, excitatory neurotransmitter. The commonest inhibitory neurotransmitter is GABA, also called gamma aminobutyric acid. Normally there is a balance between the two. What happens in that area of damage in the brain is that there is degeneration of the GABAergic inhibitory neurons, okay, so that the balance will eventually shift in favor of the excitation. Okay? The surviving neurons, they reorganize and there is hyperexcitability of the neuronal network. That's how a normal neuronal network is converted or transformed into an abnormal one. Okay? Is that clear, please?
Yes.
Okay. Next, we want to know what is the mechanism of focal seizure. Focal seizure means seizure is originating from a certain area of the brain. For example, I drew, this is a lateral view of looking at the left half of the brain, okay? And this is our motor area, this is our sensory area, these two are the language areas. This is an area called Verney Place, and when I talk, you understand the information is going into that part of the brain, and you are able to understand. This information then goes to this area called the Broca's area. And if I were to ask you a question, you are able to answer me, and it's this area of the brain, language area, that allows you to respond to me by forming verbal symbols, or if I wanted to, you can answer me in writing, and it's this part of the brain that is allowing us to do. Now let's say there is a seizure focus in the motor area, and that's where the face is represented. The face, then it's the hand, then it's the forearm, the arm, the trunk, the right side of the trunk, and then the leg is on to the other side, on the medial side. Lateral, outer, medial, inner. Okay? So how does, let's say there is a seizure focus in that area. How does seizure start producing this jerking of my right side of the mouth? Yes?
Because where that balance is shifting not off at, it's by your, I don't want to say your throat,
okay,
but your language area.
So a very smart, thank you, very nice, a very smart neurologist took a cat, exposed the brain, applied some penicillin, that damaged that part of the brain, that converted into an epileptic focus. Then he recorded EEG, is electroencephalography. Are you familiar what is EEG? It's like the EKG of the heart. The EKG of the heart, you are familiar? Similarly, it's a brainwave activity. Okay? So he started recording brain activity from the scalp of the cat, but he also put a very fine micropipette in one of the cells in the epileptic area. Okay? What he noticed was that, and if he had sampled other cells, they all showed the same abnormality, that there was periodic, come and go, depolarization, followed by repolarization and hyperpolarization. And when there was depolarization, there were a series of action potentials, like one after another, and that represented a spike on the surface of the scalp, and the repolarization, the hyperpolarization, those are represented by a slow wave. When we do EEGs in an individual, looking for whether this individual, where the seizure activity is coming from, we don't record seizures very often, but we record, what we are looking for is interictal activity. We are looking for spikes, whether they are coming from both areas of the brain or from one discrete area of the brain. Okay? That's what we are looking for. That's what it's telling us if we record spikes, and I'll show you on the EEG when you come to the EEG. Okay? Clear this one? Okay? The last thing in this one I want to talk about is what is the mechanism of a generalized epilepsy. Generalized epilepsies are that when the seizure occurs, in a focal epilepsy, the seizure starts from one area of the brain and then it can spread to other areas of the brain. But in the generalized epilepsies, we record seizure activity simultaneously over both cerebral hemispheres. Where in the brain the seizure activity is first generated, we really do not know. There are speculations, hypotheses, but nothing is proven. What we do know is that in these idiopathic generalized epilepsies, there is a very high genetic predisposition. That means there is family history of seizures in a number of family members, usually a parent or one of the siblings. Okay? In these generalized epilepsies, if you look at the MRI or the CT scan of the brain, is perfectly normal, and the individual actually functions very normally, otherwise has no problem functioning in day-to-day life, intellectually or otherwise. They're normal. Okay? Well, we divide the International League Against Epilepsy, divides epilepsy in seizures into 3 categories. And those are partial seizures, generalized seizures, and unclassified. And the 2 criteria that we used were the symptoms of the seizure, what the patient described, or let's say the patient lost consciousness and jerked all over. The patient cannot give us the description of the seizure, so we asked an eyewitness, a relative or a friend, who will tell us what actually happened during the seizure. And then on the basis of the EEG, we use these 2 criteria to classify EEGs, to classify seizure. Partial or focal means the seizure originates from one area of the discrete area of the brain. Generalized, they are occurring bilaterally, both sides. And in the unclassified category, a patient comes to see me and I don't have enough information. I have not done any EEG. That patient will be put for the time being into the unclassified category. Or in babies, newborns, they develop some funny seizures, such as swimming movements, bicycling movements, and that's a seizure. And we do not have, really we cannot put them into the above 2 categories, and that comes into the particular unclassified. Infantile spasm, usually these are babies who are born normally, or may have some congenital anomaly, but around age 3 months, 4 months, 5 months, 6 months, they start having different kinds of seizures, and usually like this. Watch me please. Okay? They develop seizures like this. It's like a salam. It's called a salam attack. S-A-L-A-A-M. Among the Muslim religion, when they greet, they say salam alaikum. So it's named after the salam attack. Okay? Okay, this is clear, please. We are going to integrate a detail about the different kinds of seizures. Okay? Now the partial or the focal seizures mean implication that there is a seizure focus in one part of the brain, right or left cerebral hemisphere. And we divide these into 3 further categories: simple partial, complex partial, and secondarily generalized tonic-clonic seizures. Okay? What is the difference between simple and complex partial? Simple partial, there is no loss of consciousness. Complex partial, there is a loss of consciousness. And I'm going to mimic the simple partial seizures. Complex partial seizures originate either from the temporal lobe or the frontal lobe. Most of the time from the temporal lobe, but they can originate from the frontal lobe also. A simple partial seizure can originate in any part of the brain, and it depends where the seizure focuses. I mentioned the motor. Let's say it's my arm area, and my arm will start jerking lights. Okay? If it's sensory, then I may feel tingling and numbness in that part of the body. If it's in the occipital lobe,
You like blackout?
no, there you see flashing lights. If it's temporal lobe, we can start seeing animal. If it's in the smell area, we smell something. If it's in the taste area, strange taste may come in our mouth. Okay? All those they usually last half a minute, 1 minute, 2, 3 minutes. Okay? That's it.
What about the psychic?
Okay? Psychic are a child all of a sudden is gripped with fear and runs to grab one of his parents. Okay? But lasts only a minute or 2. Or I may suddenly feel happy. Or I may suddenly feel very depressed. But it lasts for a minute or 2, not longer. Those are autonomic. I may break out in a sweat. Children can start vomiting. Or my pupils might dilate. Okay? My hair might stand on end. Yes?
Can you still get those symptoms without having a seizure?
Oh yes. But these they may occur once a day, once every month, once in 6 months. Okay? They just what we call paroxysmal. Okay? They are not coming all the time.
Oh.
Yeah. Yes. Some of those can happen to us, to normal people. Okay?
Thank you.
You're welcome. Any other question about this? Okay. Complex partial seizure. I said that there is loss of consciousness. And I'm going to impersonate a complex partial seizure. Okay? I'm talking to you, and all of a sudden, I stop talking and I stare. And afterwards,